give me just a little bit of an intro to like who you are, because I know who you are, but like everybody in my class doesn't know who you are.
Um, I'm Morgan Collins. I am a licensed physical therapist. I've been working for about a year now. And I'm Hadley's sister, little
Okay.
sister.
Okay. So basically, what we're gonna do is we're just gonna kind of go through just like some top five questions and maybe like a short little patient story at the end. This is part of my evidence based project. So my first question, of course, the topic of our project is mobility after surgery. So, as a PT, this is a huge part of what you do. Why would you say that early mobility is important after surgery?
Well, so definitely depending on what kind of surgery it is. Any kind of total joint replacement, they're in here 2 to 3 days afterwards. Most of the time because we're trying to get that joint moving as fast as possible, especially because most people get their knees done, and when they are done with their knees, they can only bend their knee typically about 60 degrees, and you need 140 degrees to be able to walk.
Okay, cool. So, for patients that you don't see in that like 24 to 48 hour, what complications do you see in the patients that stay in the bed too long after surgery?
Um, well, at times they can get what we call contracted. That means that they are stuck. And a lot of the times, what will happen is if they have a lot of scar tissue buildup, or they have a contracture in that muscle, um, they will have to go do what's called a MUA, or a manipulation under anesthesia, where they will be put under, and then the doctor will take their knee and basically pop it and force it to bend. Use a lot of force and force it to bend. Um, and it is very painful. It is uh, not. It is not something that you want to do. There's a lot of bruising. There's a lot of pain. Um, and going forward after a manipulation of any kind, you will be seen every single day uh, for 3 weeks, 4 times a week, or 4 times a week for 2 weeks, and then you can drop to that. And it is intensive, and patients don't want to do that.
Okay. So, kind of attached to that, so like how soon after that surgery, I know they come in within the first like 24 to 48 hours, how soon do you typically get them moving and like what do you start with?
Specifically for a knee replacement, or
And
just in general?
just in general.
Immediately.
Okay.
So, a knee replacement patient, knee replacement surgery, anything. Obviously, the first like 15 minutes of their very first session with me is me talking to them, creating rapport with them. But after that, I am moving their knee, doing joint mobility, passive range of motion, where I'm using their arm, or I'm using myself to move their arm or their knee or anything like that. And that's a good 20 to 30 minutes of that. And then I will give them some exercises that they need to do at home. And then when they come back in the next time, it's immediate. They immediately start doing, like, moving their shoulder, moving their knee, whether it be heel slides or a bike, or pulleys of some kind, something just to get them moving, so that if there is any scar tissue that's built up since the last time that we've seen them, there is a chance that it could break up.
Okay. From your experience working with all these patients, because of course you've only been doing this as a licensed physical therapist for a year, but you've been doing clinicals for the whole time that you've been in PT school. So, from your experience, what's the biggest barrier to getting patients moving after surgery?
Fear.
Fear? Fear of what exactly?
Fear that they're going to hurt themselves. A lot of the times, what doctors will tell them is that they need to be really careful with moving, and especially with individuals that come in with like a rotator cuff repair or something like that. Their doctor tells them, don't move it. Stay in your sleep, don't move it. And then they come and see me, and I'm trying to move their arm, and they're afraid that I'm going to hurt them.
Mm.
Or you've got people that have total knee replacements, total hip replacements, where they've been in pain forever because of the way that their knee was bone on bone and was just so painful for them to walk on that now they're scared to walk on the new knee because they're scared it's going to hurt.
Mm. Okay.
You also have the limitation um, of our schedule. You can't call me the day before your surgery and be like, hey, I need to get in by Friday. I can put you on a cancellation list, but that's the best I can do. I can't promise anything. So, it's scheduling, but I think the main thing that people are afraid of after surgeries is that they're going to get injured and that they're afraid.
Mm. So you're an outpatient clinic, obviously, so you don't see them in hospital when they're in the beds, and you don't really have a lot of interaction time with us as nurses in the hospital. But what would you suggest? How would you encourage nurses to help promote mobility in their patients that are those post-op still in the hospital after surgery?
Get them up and walking as fast as you can. If you look at acute care physical therapists who are after like coming and seeing their patients after surgery, most of the time the patient wakes up and an hour later the therapist is getting them up and walking, getting them up and down getting them to a different chair across the room, getting to them to the bathroom, whatever it may be. Like they're gonna get them up and moving. So, like, I know nurses they have a lot more to do, but even if it means, you know, getting them to a different chair, their bed's here, their chair's here, getting them to this chair is gonna help them.
Mm-hmm.
Because they're moving, they're putting weight on their leg, whatever it may be. If it's a shoulder, depending on the type of shoulder injury it is. If it's a rotator cuff, just let them be. Don't try and touch them unless it's the PT doing it.
Okay.
Just because there are certain things, you don't want them to move their arm themselves, but that's beside the point. If it's like a rotator, or if it's a shoulder surgery where that person can move their arm by themselves, have them reach for their water cup, put it on. Say they had surgery on the right side, put their water cup on the right side, put their call button on the right side, so that they have to reach for it in some way.
Okay. So it doesn't have to be like, oh my gosh, I'm doing like passive movements with my patients. We leave that for like the physical therapist, but that doesn't mean us as nurses should be afraid to move our patients. Doing things simple as like their ADLs, getting up and going to the bathroom, putting them in the chair, making them reach for things on that affected side, like as far as their arms and things like that. Because, I know for me, outside of being a student nurse, it's definitely something I have fear about as well. As like, I don't want to like mess up the patient and then get yelled at by the surgeon.
Yeah, and I mean, with acute care therapists, like you can always ask them, and if you're comfortable moving them, if you're comfortable grabbing that person's arm and lifting it up for them, and you know what to feel for, there's no reason why you shouldn't be able to do that. But always, always, always clear it with the physical therapist first before you go in there and try and do
Let
that
me just.
um, because you don't want to end up hurting them
Mm-hmm.
or potentially re-tearing whatever was torn, or move them too fast. But just because I said that you can't do it doesn't mean that, or just because I said you shouldn't do it doesn't mean that you can't. You just need to follow up with your um, the therapist that's on that person's case, um, and let them see you do it in action, or let them teach you how to do it.
Okay, cool. Um, we just have a little bit of time left because I don't want to take up your whole lunch. Um, can you give me like a short story of a patient that you have taken care of, whether that be like right now in the year that you've been licensed or when you were in clinical, that surprised you with how much better they did, or they surprised themselves with how much better they did once they had started moving after that surgery?
Sure. So I recently had a patient who was a meniscal tear, so in their knee, and they were incredibly scared to move. They were scared to do anything at all. And when we got to her initial eval, she had, I mean, I was trying to move her leg, and it was like I was trying to push up against a brick wall because she was fighting me so hard. Um, and eventually, she started to trust me and started to let me move her leg a little bit more inside of her initial evaluation that I had. And she was shocked by how much I was able to get her moved, how much bend that she was able to get. Because with her, I believe that she was, um, I think she started out at like 50 degrees, maybe 60 degrees. And when I finally got her to trust me and relax a little bit, and was educating her on why I was doing what I was doing, I think I was able to get her to like 95.
Wow.
Um, and as we have continued to create that rapport and work together, she's able to. She came in last week. She was able to go for a 3 mile hike,
Wow.
and thought that she was never going to be able to do that again after her surgery.
That's amazing. That's awesome. Um, okay. Well, I appreciate you taking the time. Oh no, you're perfect. Okay, taking the time out of your out of your lunch to answer some questions with me. Um, I guess our one little tagline, I guess, would be, what would be the one thing that you would tell your nurse that's working with your patient before they even get to you? What would be the one thing that you tell them or advise them to do? Encourage.
Regarding mobility
Yeah.
after surgery, oh gosh, that's a hard question, as I don't really mess with nurses very much. But um, I guess I would say, like, don't let the fear of doing something wrong keep you from helping your patient move.
Mm. Okay. All right.
If you feel, or if you're afraid that you're gonna do it wrong, it's better to ask and make sure that you're doing it right, than not doing it at all.
Okay. Very cool. Well, I appreciate it, and I love you.
Love you.
Have a great rest of your day.